Acute onset low back pain is often perceived as a catastrophic injury that is falsely associated with permanent damage to the spine, when this is actually rarely the case. The vast majority of lower back injuries are self-resolving musculoskeletal injuries that are best approached by continuing to engage in physical activity with some common sense modifications. Medical imaging is rarely indicated, and findings on spinal MRIs are often unrelated to the actual pain. In fact, patients both with and without back pain will demonstrate an abnormal spinal MRI with increasing likelihood as they get older. Degenerative changes to the spine are part of the natural aging process and can often remain asymptomatic in otherwise healthy individuals. There are certain cases of acute onset low back pain that require emergency medical evaluation, such as loss of bladder or bowel control, loss of sensation, or paralysis. In these cases, diagnostic imaging and emergency surgical intervention will probably be needed. Seek help immediately. I also need to add the disclaimer that this post is for informational purposes only. Your health is your responsibility, and it is up to you to seek professional help if you have concerns. While I may be a medical doctor, no doctor-patient relationship is being established in providing this information, and the viewer assumes all responsibility for what they do with it. Okay? So let's say you're performing an exercise such as a deadlift. You're fatigued from a poor night's sleep, stressed from a demanding work schedule, and arrive late to your training session. You decide you want to save time, so you skip your warm-up sets. You begin adding an amount of weight to the bar that you would usually only use after a few warm-up sets with lighter loads. In an unfocused and hurried manner, you yank the bar off the floor and immediately feel a sharp pain on the right side of your lower back. You shriek in pain and drop to the floor. When you're able to get back up, you feel a sharp pain when you try to stand. Any torso rotation or bending seems to make things worse, so you remain as still as possible. Your trainer decides to end the session and sends you home with instructions to rest and recover, with plans to resume training after your back feels better. In the ensuing few days, you decide to avoid any position that aggravates the back pain. This includes bending over to pick things up and twisting motions. These restrictions in motion end up interfering with daily activities, like putting on your socks or getting in and out of your car. You decide to see your chiropractor, who takes an x-ray, tells you your hips are misaligned, says that you have an L3, L4 subluxation, does a spinal manipulation, and tells you to come back for 9 more adjustments. Each adjustment seems to provide some temporary relief, but the pain persists. Desperate for relief, you see a masseuse, and they perform some myofascial release techniques using CBD oil for a good measure, which seems to help a little bit. After a month of dealing with this, you decide to see a medical doctor, who orders a spinal MRI showing a herniated disc. You're advised not to lift anything heavier than 10 pounds and to take up some low-impact cardio like water aerobics. Opting for conservative management, they give you some muscle relaxants and prescription anti-inflammatory medication to help you get through the acute phase while your back heals, plus or minus some opiates depending on the doctor. They also refer you to a physical therapist who makes you do bird dogs and planks until you're bored stiff. 3 months later, the back pain is improved, but still interfering with everyday function. Bending is still uncomfortable, your back hurts during long car rides, you struggle with housework, and having to tie your shoelaces is an ordeal. Although the back injury has resolved, you have now established a strong association between moving in certain ways and back pain, which continues to limit your freedom of movement. There's no longer a structural abnormality, but because a feedback loop has been established during a protracted recovery process, you continue to receive pain signals despite no evidence of damage being present. Over time, what started out as an acute injury that should have been self-resolving becomes a chronic problem, all because you were not encouraged to keep moving. So, how do you avoid this tragic fate? By doing the opposite of what you think you should do. You keep moving and gradually work your way into the very ranges of motion associated with the back pain. Even if bending over hurts your back, you will have to start doing some version of bending over, cautiously and gradually working your way back towards a normal range of motion. Even if squatting is uncomfortable, you'll need to start squatting to a tolerable depth until a full range of motion is restored. It is important to understand that as long as this is done deliberately, at manageable loads, in a tolerable range of motion, it is not going to cause any more damage, which is what most people are concerned about. In fact, it will accelerate recovery. And not attempting to work your way back towards a full range of motion early in the process is a setup for it becoming a chronic problem. For example, if you hurt your back bending over to pick something up, either outside the gym or while doing deadlifts, you would start by doing a deadlifting motion unloaded using something like a PVC pipe. Only work within a range of motion that is tolerable, but do not expect it to be completely comfortable. We are cautiously stepping into the discomfort without inadvertently recreating the injury. It's important to start light, move slow, and be patient. Uncontrolled sudden motions are to be avoided. Work your way into a full range of motion first, then gradually advance the load as tolerated. You may be wondering why I haven't covered the various anatomical structures that may be involved in a lower back injury. That's because other than in rare medical emergencies, the symptoms of which I covered earlier, it's largely irrelevant and doesn't change our management. Whether it's your quadratus lumborum, multifidus muscle, psoas tightness, hip flexor tightness, sacroiliac pain, or even a herniated disc, the management is largely the same. The approach is working back into a full range of motion with the movement associated with the back pain in a slow, progressive fashion. This approach generally works across the board. Yes, there are rehab exercises that focus on core strengthening, glute strengthening, and stretching, but they shouldn't supplant attempts to actually work back towards a normal range of motion. They are, however, useful as additions, and weaknesses and imbalances can sometimes predispose you to injury. The relative loads and increments you progress by will of course be determined by what you were lifting prior to the injury, but the principle remains the same: small increments using light loads and moderate rep ranges. The same gradual progression would be implemented with squats or any other movement you're trying to build back up. The key is to start light, work within a tolerable range of motion, go slow, and be patient. I know what I'm saying goes contrary to the biomechanical model endorsed by many rehab modalities, but practitioners familiar with the current literature are likely to recommend returning towards normal physical activity as soon as possible. I also realize that many individuals have resorted to and seen a fair degree of success with a certain therapeutic modality and have attributed their recovery to whatever they were doing at the time. Remember that the vast majority of injuries heal on their own without any intervention, and it is very easy to draw false associations.